what we're going to do for now, we're going to go back to Lwando Nomoyi, who's out in Port Elizabeth. We carried the story a bit early on, where the Minister of Health is currently doing a walkabout in that province. Remember, the province there, about 50% contributing to the overall infections of COVID-19 here in South Africa for now. So let's go there and give you these live pictures as the Minister does a walkabout within some of the facilities, as he said, to try and avoid the second wave as it would be of COVID-19. The Ministry checking facilities there. Let's go there now live.
So we are still busy now with stationery from the ward. Sorry.
Well, thank you very much, Tabi. So as you can see, that the Minister is doing the walkabout currently at this newly built wing of this hospital in Dora, Nginza. These are just some of the efforts that the national government has done, to intervene and to intensify the fight against COVID-19 in the province. You'd understand that the President, during his address last week, also raised concern in the numbers that were rising within this particular metro. Now, these are some of the interventions that this particular wing has been completed, and the Minister there with Health MEC, Ma'am Cindy Sogomba, and the CEO of the hospital just being briefed on this particular facility.
I'm so excited now because the POC there is going to move now to another. Oh, there she is. Talk about you. There she is.
Wanda, can you get the mic in closer so we can possibly hear in on the conversation?
Yes. It's very good to see you, and I'm glad you're in good health.
Yeah. I shook my COVID away.
So did she.
Oh, you did?
Finally, same. Yes. 1 week after you. Yes.
Oh, that's good.
Yes.
But now you're fine. You didn't take long COVID. You took the short one.
Yes, I needed to be back at work.
Nice to see you.
It's good to see you.
Yes. Okay. No, I'm just impressed. I see Mrs. showing me. It was like an old broken place.
Yes, it was.
Yeah.
And we managed to successfully convert it with the help of everyone.
Yeah.
So we're going to have PUI beds, and we're going to have a COVID section where we're going to put our high flow nasal oxygen patients on.
Yeah.
So we've now got 14 machines that we have.
Oh.
Which is 14 more than we had the last time.
Yeah.
Which is a big difference. And currently now we'll be able to use 60 of the 100 beds, and when more staff comes, we will then be able to use the whole 100-bed facility.
And prestigious private wards, eh?
Yeah. We're calling this Dora Private.
I'm telling you, I walked in here, it's 2 beds, it's 1 bed. It's really high quality.
And the most important thing is that each bed has got its own oxygen port.
I noticed that.
For the first time, we're able to put patients on a face mask and nasal prong.
At the same time?
At the same time.
Yeah.
Lovely. So it's really made a big difference, and we really appreciate it.
Yes.
Because it's going to make a big difference for our community.
Yes.
Yes.
The most important thing is the confident professional looking after the patients because the equipment is adequate. That's the most important thing. And so for me, if that's how you feel and that's what you've done with your COVID money, then I say well done. Well done, because this would have otherwise been derelict, unused. Now you've got a number of beds, and it's like a new hospital for the next many years to come.
And it's given us a new lease, new energy.
Exactly.
We were feeling so tired and demotivated.
Yes.
And now we feel like we can, tackle this head on.
Yes.
So we're ready.
Nice to see you.
Very nice to see you.
All right. Thank you. I think we can.
Okay. As you've seen there, Thabiso, the minister, interacting with the delegates responsible for this facility, to be turned into such a beautiful place. It's actually marvelous, if you would see it in person. The beds, the way they've been structured, with the oxygenation that they have, and the ventilation as well. So everything is really up to par, and we hope that this indeed will actually flatten or stop the second wave within this particular metro before it escalates.
Thank you very much indeed there. As the minister does his walkabout, if by any chance the minister do stop somewhere and gives maybe a report on what he's seen, and maybe if you can speak to the hospital management there on your time, please do come back to us. We'll try and get that on air. Obviously people around that area to get some information from that press briefing.